How does diabetes cause weak erection, cause vaginal dryness, cause heart disease, cause the issue that has to do with kidney failure, cause issue that has to do with foot ulcer, and so many other things? How does it happen? Now listen to this. Diabetes prevents the cells from eating. So, in a number of occasions, there will be so much food in the blood vessel, but the food is not reaching out to the cells. So, over the time, the cells will start dying. And I have this to tell all men. Please listen to this. We can't undermine the fact that quality or good erection is essential for stability of marriage. We can't use faith to cover it. It's a reality. You need to have a good erection. So, and I have this as a major concern to tell any man you know. Please, one fundamental thing you should understand. Let me tell you this. For a man to achieve erection, behind your back here, you have a tree of nerves they call parasympathetic nervous system. All right? These very nerves stand as a mask, MTN mask, all right, for those networks. Right. And it is this network that receives signal. And when you receive that signal, some form of erotic or any form of stimulatory signal by touch, by sight, or whatever, you know what it will do? It will send a message to the brain. The brain will now interpret what is being seen, or what is being sensed, or what is being touched. And by understanding of that, it will release a chemical messenger called cyclic guanosine monophosphate. Please, let this grammar not confuse you at all. That is the purpose of this meeting, to decode medical terminology in a common man's language, which we trust God that by so doing, many could know what is their problem and come out of it. Now, listen to this. When that cyclic guanosine monophosphate is released alongside with what they call NO, it releases that into the blood vessel and causes the blood vessels to open. Now, watch this. When the blood vessels open, blood moves into the chamber. Those balloons, they call this spongiosum, all those when are inside the penis, and it makes it to start enlarging, and it can get erected. Now, please, why I'm talking this, because this is the undoing of many families here in Nigeria and beyond. Now, when this erection is there, following the release of phosphodiesterase, after ejaculation, it cannot be in position to come down. Now, listen to this. This is the pathway. It is the blood that causes erection. It's not iron. It's not any form of manipulation. So, what exactly could diabetes cause an issue of affecting a man? That is his primary assignment. Knock the man down. Knock the man down. The question now is, what role could have that diabetes cause this particular man in terms of his potency as a man? Now listen to this. Just a quick recap. We established last time that when you eat your food, the food goes to the stomach, get digested, just a recap, and when it gets digested, it moves into the blood vessel, all right? But anything you eat, the cells will need those glucose, need those sugar, but they can't enter. So it discovered that even when this glucose is dropping, it can't enter the cell. But what does the body do? It will produce this very pancreas that will release insulin. It will go into the cell. This insulin will now make this very cell that doesn't have access for this glucose to go in. It will now come inside, create a channel, open the mouth, so that the food, the drink, and all that will be there. In a situation where it is not there, like in the case of diabetes, if you check out here, where there is relative insufficiency of insulin, as in the case of type 2 diabetes, we have more here, it discovered that this glucose are there, Water is there, but they can't enter the cell because the insulin is not enough. What is the implication of this? The implication is the person will eat, take enough drink, but the cells of the body will not get it. That's why you see some of them are over the time we start losing weight. But you know what? That cell of the body, the most striking one they hit is the aspect that has to do with the nerves. And what is the number one nerve? The man needs it most. That one at the back. When you knock off those nerves, so at the initial time, like I asked one of my old friends, and I asked him, my friend, what is the erectile performance like? He said, Doc, the network, they come, they go. I have a detailed understanding of that word. He said, the network, they come, they go. That is to say, sometimes you go there 2 bar, 1 bar, sometimes the network will go off. The reason is, by the time the nerves start getting affected gradually, the power of the potency will start dying gradually. At that time, you will not say, the thing not be strong as it is strong before. Another occasion, it will come to a point where the thing now will be flattened. The person will be looking. There's no messenger to take what he's seeing to the brain. It will be like a person who has glaucoma. The eyes are open, but not understanding the whatever he's saying. That's exactly what happened in the area of men. This also will affect the nerves of all the extremities. That's why you see people that have allowed diabetes to mess up their life. Sometimes even they will be touching something, you will not be feeling it. They may hit something, they will not feel it. Sometimes their footwear will pull out, they can't feel it. The nerves are dead. So that's why when they start having wound, the wound will not heal and all those kind of stuff. All right? So this is one thing. The same thing also could happen where this diabetes is left in a woman over time. Because the cells are not getting water, most of those vaginal glands will be dry. So the woman will start having vaginal dryness, from vaginal dryness to issue that has to do with candidiasis and all that, because glucose will full everywhere, nobody eating it up. So other opportunistic infection like candida will now enter there and it become a house for them. All of these are the problems.
You and your health with Dr. Richard Okoye.
Diabetes also affects the blood vessels. It causes damage to the blood vessels by reason of excess sugar in the blood circulating, will cause arteriomatous plaque, or what is called arteriosclerosis. No big grammar, please. Just check out this. Inside the blood vessel, okay, you can see fat deposits, thereby narrowing this blood vessel. The implication of this is that it can cause a problem of heart attack. It could also a possibility that if this detach and start flying from the heart to somewhere else, if it gets to the brain, it will cause a stroke. These are all the things that could be in position to happen to a person who has diabetes, and perhaps somebody is telling him it's an attack from the devil, from his enemy. You can continue that kind of narrative, and you see many of our people dying, and you want to join them. That diabetes is a systemic illness. It affects all the organs of the body. The same principle is using here is the same principle is also using for the issue of kidney. When the blood vessels in the kidney, when the blood vessels, this is the kidney right now, you can see the blood vessels inside the kidney. If there be a narrowing of these very blood vessels, the kidney cells will start dying. If the cells of this very kidney could not receive food and water, even though water is coming there but they're not taking, that very person will also have a problem of kidney failure. That's why I want to announce to you, but bad news, diabetes is the commonest cause of kidney failure in the world. The commonest. Of course, you can understand the pathology now. And a lot of stuff associated with this particular condition. Diabetes, hypertension ought not to kill you. No. it can be managed in the present circumstance until God provides with more assistance to that. As part of our campaign to eradicate health ignorance in our society, we provided this very package and said, do you or your loved one have a health challenge? You don't know what to do, or you have a confused, or they're telling you it's a devil. Why not make use of this very thing? Send in any of your health challenge. We will come back here without the name, because your problem is a problem of others. We share it. And whatever you get, as a team, let's keep sharing to other people. I tell you, there is power in knowledge.